Welcome to our video on thalassemia, a genetic disorder that affects individuals worldwide. Join us as we explore the causes, symptoms, diagnosis, and treatment options for this condition. Thalassemia, a genetic disorder, disrupts the production of hemoglobin in the body. Learn about its causes, symptoms, and prevalence in different populations. Discover how thalassemia, a genetic disorder, impacts the lives of individuals. Understand the genetic aspects and its effects on hemoglobin production. Hemoglobin is crucial for carrying oxygen in the body. Explore how thalassemia affects hemoglobin production and leads to health complications. Learn how thalassemia, a genetic disorder, disrupts the body's ability to produce sufficient hemoglobin, resulting in anemia and related symptoms. Anemia, a common consequence of thalassemia, can cause fatigue and shortness of breath. Discover how this condition affects individuals and their daily lives. Explore the available treatment options for thalassemia. From blood transfusions to medications and bone marrow transplants, learn how these interventions can improve the quality of life for individuals. In conclusion, thalassemia is a genetic disorder that affects the production of hemoglobin, leading to anemia and other health concerns. Remember to seek medical advice and learn more about this condition.
Alternative medicine refers to a diverse range of medical practices and products that are not considered conventional or mainstream by the medical community. These practices and products often fall outside the scope of conventional medicine and may be used as complementary or alternative approaches to treat or manage various health conditions. It's important to note that while some alternative therapies may have anecdotal support, not all of them are scientifically proven or widely accepted within the medical community. Regarding thalassemia, it is a genetic blood disorder characterized by a reduced or absent production of hemoglobin, which can lead to anemia. Thalassemia typically requires medical management, and the standard treatment often involves blood transfusions and, in some cases, bone marrow transplantation. Alternative approaches to managing thalassemia might include dietary supplements, herbal remedies, and other complementary therapies. However, it's crucial for individuals with thalassemia to consult with their healthcare providers before trying any alternative treatments. Conventional medical treatments are generally well established and have a substantial body of scientific evidence supporting their effectiveness. If you are interested in exploring alternative or complementary approaches to thalassemia, discuss your options with your healthcare team to ensure that any additional treatments are safe and will not interfere with the standard medical care you are receiving. Always prioritize evidence-based practices and consult with healthcare professionals for guidance on managing thalassemia. Diet can play a supportive role in managing thalassemia, but it's important to note that dietary measures alone cannot cure thalassemia. Thalassemia is a genetic disorder that affects the production of hemoglobin, and its management typically involves medical interventions such as blood transfusions, iron chelation therapy, and, in some cases, bone marrow transplantation. However, certain dietary considerations may be helpful for individuals with thalassemia. Here are some general guidelines. Iron management. Thalassemia patients often receive regular blood transfusions, which can lead to iron overload in the body. Iron chelation therapy is commonly used to remove excess iron. It's important to follow your healthcare provider's recommendations for iron management. Avoid excessive intake of iron-rich foods or supplements unless advised by your healthcare team. Nutrient-rich diet. Consume a well-balanced diet that includes a variety of nutrient-rich foods such as fruits, vegetables, whole grains, lean proteins, and dairy products, if tolerated. Ensure an adequate intake of essential nutrients like iron, within recommended limits, vitamin C, vitamin B12, and folate. Calcium and vitamin D. Thalassemia patients, especially those receiving treatments like bone marrow transplantation, may have increased needs for calcium and vitamin D. Include dairy products, fortified foods, and sunlight exposure to meet these needs. Hydration. Stay well hydrated, especially if you're receiving treatments that may increase the risk of dehydration. Avoid certain foods. Some individuals with thalassemia may experience digestive issues. It might be helpful to avoid foods that exacerbate gastrointestinal symptoms. It's crucial to note that individual dietary needs can vary, and the recommendations may be different for each person based on factors such as the severity of thalassemia, treatment plan, and overall health. Therefore, it is highly recommended to consult with a healthcare professional, preferably a registered dietitian or nutritionist, who can provide personalized advice based on your specific situation. Always follow your healthcare provider's instructions regarding medical treatments and dietary guidelines. Thalassemia management should be a comprehensive approach involving a healthcare team to address various aspects of the condition.